Hi guys, this is Dr. Shamima Sattaruna from the YouTube channel Doctor to Help. Today's 4th of July, the Independence Day for America, and we are going to talk about migraine. For those who don't know me, I'm an internal medicine doctor, board certified, practicing in Texas. Today, we are going to try to understand migraine. What is migraine? Why does it happen more in women than men? What is the pathophysiology? And why does it have different presentation for every people? To understand migraine and to treat it, we first have to understand the pathophysiology. Let's try. Think about our body. Our body has so many billions of neurons. What are neurons? They are nerve cells that gather all the information from all over the body, and then it passes from one neuron to another and keeps on connecting and go all the way through the spinal cord, through the brainstem to our brain, the big boss, and gives all the information from all over the body. And the big boss then gives instruction for us to react, right? So it is thought in migraine that there is genetic mutation that breaks that signal, that makes all that information cross from one cell to another, kind of makes it disrupted. There are ionic channels and neurotransmitters between two cells, and when this communication is messed up, all the information to the brain can get messed up, and then the brain misfires. So the neurons start sparking. Just think about electricity. It sparks. The neurons start sparking even before it should, and then it goes into a cerebral cortex compression or suppression. And when that happens, we have the prodromal period of migraine. What is that? This is the period where you can have certain symptoms like yawning, you can have fatigue, you can have depression, anxiety, you can have muscle aches, you can even have vertigo. All these symptoms happen in the first maybe 2 days, all right? So in that first 2 to 3 days, you want to identify those symptoms so you know a migraine is building up and maybe you can prevent it. So what happens? All that sparking causes some vasoconstriction in the blood vessel. When that vasoconstriction happens, that's when the prodromal period happens. When the vasodilation happens, that's when neurochemicals are released and there's vasodilation, and that's when the headache happens. So before the headache happens, there's a certain period that is called aura. In aura, it can happen between 4 hours to 72 hours period. Some people may have visual aura. That is, you can see some zigzag, blind spots, some flickering lights, and these can gradually increase, and it can even take up half of your vision, all right? And it can be very scary. In some people, there can be sensory symptoms like your hand, you can have burning and tingling, numbness, and that can occur all the way to your elbow. It can even pass up and also occur in part of your face, because the brain that supplies this part of the face also supplies the hand. So you can have numbness and tingling in that area, all right? You can also have other symptoms like hemiplegia, that means weakness in a part of the body. So for somebody who has no history of migraine, they would think they're having a stroke. Yes, it can be terrifying. Now, a normal aura, these visual symptoms and all this should not last more than 1 hour. They usually runs about 15 minutes to 30 minutes. So if it runs more than 1 hour, time to call the ambulance and go. And if you don't have any history of migraine, you need to call the emergency no matter what, because as far as we are concerned, it can be stroke. And you know, if you have a stroke, it is vital that you go to the ER in the appropriate time so that we doctors can treat you and reverse the stroke, because it is reversible if you come to us on time. So time is of essence. So what happens in aura? We already talked about. Now next time it's going to be headache. Not everybody can have headache. Like I said, some people can have aura symptoms that present like stroke, and they may not have headaches at all. So this period happens for about 2 days, and then finally is the postprodrome stage, and at that time you can feel weak and tired and fatigued. It feels like a hangover. So that lasts about 2 days. So this is the pathophysiology of migraine. So what can we do to prevent this? We are going to talk about that in a separate video because I do not want to make these videos long. So we are going to talk about prevention and treatment in a separate video. So if you like this video, please like and subscribe and share with your friends who have migraine, because a lot of people needs to understand this. And we are going to talk about prevention and treatment on next video. Thank you for joining me. Like and subscribe if you like it. If you don't like it, please leave a comment so I can improve myself. And thank you again for joining me. I'll see you next time. Bye-bye.